Hello and welcome back to Dr. Carri's Clinical Corner. And today we're going to talk about why Kegels are not enough if you have bladder leakage when you exercise. This also probably applies to coughing and sneezing. So our Kegel, our pelvic floor muscles, let me show you the model. So here's the pelvis. On the bottom, this is a female model. All the red is pelvic floor muscles, and the bones, we don't have any bones down here. So just our muscles are supporting us. So when we do Kegels, we are contracting this muscle and strengthening this muscle specifically. These muscles are really thin. They're not that big. And when we run and jump, for example, the impact of that motion is like 2 to 3 times our body weight. So do you think these small muscles are strong enough to hold 2 or 3 times your body weight? Absolutely not. So we start with Kegels, right? We got to make sure these muscles are doing their job, but that's not enough. The other thing that I like to tell people is that our pelvic floor muscles, when they're just working normally and we don't have a problem, they are what we call automatic. They sort of predict when we're going to move and they contract. And this happens faster than we can think. And so that's eventually what we need to train. So yes, in pelvic floor therapy, we might start out doing Kegels, doing direct pelvic floor stuff, but that's probably not going to be enough. And that's why. So in my practice, we'll start out with pelvic floor assessment, doing Kegels if we need, but eventually we need to practice the thing that's causing you leakage, whether it's running, jumping, jumping jacks, lifting heavy weights, like whatever the specific thing is, we need to mimic that so that we can train those muscles to automatically contract and prevent leakage with those activities. So a Kegel is a volitional movement, what we call a volitional movement. So a volitional movement is I want to do this movement, right? I'm telling my biceps to contract. Where an automatic movement is like like a reflex, right? Like boom, you have a reflex here and it just goes. That's not 100% accurate, but sort of that's a way to think about it. Okay, so we need to train the pelvic floor muscles to automatically contract. So what happens in everyday life, like every time we step, the pelvic floor muscles contract, just briefly enough so that we don't leak urine. And so we need to train that with running or jumping too, or whatever the exercise is, lifting heavy weights, pushing, pulling, picking up your baby, whatever the exercise or movement is, and coughing, sneezing sometimes too. Coughing, sneezing is also like significantly more pressure down on your pelvic floor than your pelvic floor would ever be able to resist. And so we got to train those. So sometimes with my athletes, we look at how are you running? How are you jumping? How is your lower body strength? Do you have sufficient knee strength, hip strength, quad strength, glute strength to support all of your pelvic floor, right? Your pelvic floor is like these small, tiny muscles, but we have much bigger muscles in our body that should be absorbing the impact. So that's one thing to think about. And then we want to retrain that automation of those pelvic floor muscles to just automatically contract just that little bit so you don't pee or poop. You could have fecal incontinence too when you're doing whatever the activity is. So that's why Kegels are not enough. So all these Kegel devices, pelvic floor devices that are like advertised to you aren't usually gonna do it for that reason. So Kegels, yes, it's a piece of it. Also some of my athletes, they have tight pelvic floors, and so we gotta like get the muscles to relax because they should contract and relax very easily. So if they're always in a contracted state and then you land on that, like it's also gonna give out. So there's a lot of reasons that we don't just do Kegels. And in order to get back to exercise or movement without leaking, you got to do more than Kegels. So hopefully that helps.